Welcome to Welcome to Cut the COVID Crap number 60. Excess mortality not split by vaccination status and some predictions. T-shirt of the week, same as last week. I did wash it before. To the lines that you are, or the awakening lines, I suppose. So, excess mortality not split by vaccination status. Um, what I see more and more in the studies and the data that I encounter is that vaccination status is not made explicit for some events. Um, per example, Dr. Bean discusses this. This is in Nature Medicine. Um, it the article, the link is below as usual. The article is called "Long-Term Neurological Outcomes of COVID-19." So it seems to be a good article. Again in Nature Medicine, and it shows the neurological effects of COVID-19. Great study, but and a big study, but they don't show the vaccination status. I mean, it would be very interesting to see if there's a difference in the neurological effects of COVID-19, whether it's due to COVID-19 or to the vaccination status. But it's not made explicit. Um, and that's the strange thing. I mean, if well, actually, let me just discuss one other study before. That's done by Vinay Prasad. He always picks up latest research too. Um, he discusses also published yesterday a paper in the Lancet. It's called "Outcomes at least 90 days since the onset of myocarditis after COVID vaccination in adolescents and young adults in the USA, a follow-up surveillance study." So this one does look specifically in the case of myocarditis after vaccination. So that's a known small side effect, depending on what you think small is. But I mean, it's a Thai study suggested, a Thai prospective study. I probably put it in the link below as well. Suggested that it happens in 2% of the cases. So whether you think it's small or not, it's up to yourself. Anyway, Vinay Prasad in that Lancet study, he goes through that in detail, and the thing that bothers me in that and bothers him as well is they have a column of the recovered cases, but the recovered cases, a lot of them still take medicine, so they're marked as recovered, but they are on medicine ongoing for who knows how long. So you can look at those kind of studies superficially and say like, oh, myocarditis recovered, no problem. Well, if you continue to take medicine, and there's a risk of how do you call it, the tissue that's a scar tissue on your heart, yeah, it may have longer term repercussions, even though you are out of the hospital. Anyway, those kind of things, it makes me wonder, right? I mean, most governments, at least most Western world governments, are still pushing for vaccination. It's safe and effective, they say, right? And again, I'm not against vaccination at all, but what is safe and what is effective? I've said it before. If 2% of the kids in that Thai study, 2% of the male kids, 13 to 18 years old, get myocarditis or suspected myocarditis, Uh, is that safe? I mean, it's a small number, but would you consider that safe? I mean, I don't know any vaccination, any other vaccination that has safety the safety numbers that are that as high as the ones as the Pfizer ones, for example. Um, is it effective? I mean, if you have 4 vaccinations and then you get COVID, would you consider it effective then? I mean, it may have some beneficial effect. Don't get me wrong. I'm not by definition against even COVID-19 vaccinations. They may be of some benefit, but like if you have 4 and then you get it, I don't know of any other vaccination that you. I mean, tetanus maybe you get it once every 10 years, but if you and then it protects pretty well. Okay, yeah, maybe the flu. Maybe the flu is on a similar level as the COVID-19 vaccinations. You have to take them every year, and then it's still a pretty high chance that you get it. But there's no pressure on the general population to get. We never had flu vaccination passports, and that's what got me going in the beginning. I mean, when I used to be a sheep, like yeah, just following the medical advice. I don't have a medical background, but like if the government start to say like, oh, when COVID broke out, like oh, masks don't work. I'm like, hang on. In Asian cities, they wear ever since SARS, the mask wearing is um, pretty common. I start to think. I start to yeah do my own research. Um, but now, fast forward to now, if you're still even considering getting a another vaccination, you have these myocarditis studies, especially for young males. You have certain adult death syndrome. Um, it doesn't happen often, but significantly multiple factors more than 10 times more than they used to happen. Um, uh, I would be the first to rush to the vaccination to get vaccination for my kids if it is clear in those cases the sudden adult death syndromes that the it happens more in the unvaccinated. It could be a side effect of COVID or an after effect of COVID, but like if the government wants to convince me to get vaccinated, especially those ones, make the data available. Of course, they say now, because of privacy reasons, we cannot make those data available. But yeah, they can still research it themselves, and then say like, now we've had I don't know 2,000 cases of sudden adult death syndrome, and um, in I don't know 50% of the cases it's unvaccinated. I'd be rushing out to get vaccinated to get my kids vaccinated. Um, but now they don't say anything on that. They do say, oh, vaccination is safe and effective, but they don't show these data. Well, I don't know what you do, but I start to think then um, um, that would be the easiest way to convince people. Again, I'm not against vaccination, but like vaccination, like any medical intervention, has a risk benefit, and you need to assess that. And it may be very different for different age groups. So, again, with this, if you or your friends are considering to get their booster, given all this sudden adult death syndrome, given the myocarditis that you see, they've had four vaccinations. After that, they got COVID, and now they think to get vaccinated or to get a booster. I mean, pre-COVID, if I had measles, just recovered from measles, and then my GP tells me, "Oh, you've recovered from measles, but you need to get a measles vaccination now." After all, I'd be like, I don't have a medical degree, but like, come on, you have just recovered, you got antibodies. Um, uh, doesn't make sense at all, right? And like, show me any study that shows that if you've had COVID, that and you recovered from it, that a vaccination on top of that helps. I look. try to look at all the studies I can see. None of them prove this. Um, well, probably they don't want to publish the ones that disprove it. Anyway, if if I mean, the COVID is done, right? I mean, uh, likely more than 80% of the whole population has had COVID. I mean, a few people that decided to lock themselves up, maybe they haven't. I mean, if you look at Africa, for example, it's a done deal there, right? And it started in South Africa first. So and people would say, people that are very pro vaccination would say like, oh yeah, but in Africa the deaths are underreported. Really? I mean, um, I made a cut the COVID crap video number, what was it, about Omicron. That was number 15 in December 21. So uh, 10 months ago, 9 months ago, 10 months ago. Um, I made a when Omicron came out in the news of the Omicron variant came out in South Africa. I made a video saying Omicron is a relief for us. It replaces Delta, and if you look at the reports from South Africa, there's plenty of cases, but it doesn't go hand in hand with hospitalizations. Even if deaths would be underreported, you heard in the very beginning of the Omicron outbreak in South Africa from the health authorities that the hospitals were, unlike in the Delta period, the hospitals were not getting full. It is a milder disease. That's why Africa is done. But anyway, if you still think you need to get the booster, by all means, do it. I mean, I cannot recommend it. I'm not in a position to recommend it. But like with all this, all these things which make you think, you still want to blindly follow the government narrative. I hope you do it, because I mean it's the new bivalent booster is tested on 8 mice. We need we need humans to try it out and then see if it works or not. If you want to be a sheep like that, then by all means go for it. Anyway, that was my rant. I want to talk a little bit about predictions, because like I think it's important to be honest about your predictions and like what you say it's going to happen and what the actual outcome is. So what did I predict before? I told you that the masks triggered me. Also, before I started making the videos, the uh, boosters was another thing. Like very early, I think even before you could get your vaccinations, they talked about boosters already, and that was a red flag to me. Like, hang on, you need to get vaccinated, but they know already that you need a booster based on what data exactly? So I was like, well, in deciding whether or not to go for a vaccination, I was like, well, I is this the stepping stone? Are they going to require? I, at some point I was like, well, if this is their message now, then I bet they're gonna go for make it a yearly thing and get a vaccination passport. And what did it end up to be? Every half year, right, or every 3 to 6 months, you're supposed to get your booster. Um, and also, when they started first talking about vaccination passport, it was like, oh yeah, it's good to track your state to digitalize what your vaccination status is, but there's nothing is gonna be mandatory. I'm like, yeah, right. I mean, you've seen these stepping stones before. Yeah, if they're gonna announce that, then the next thing is once your, how do you call it, overton window is shifted a little bit. Next thing is actually the vaccination passports are used to allow access or not to travel or to restaurants, whatever. And that's what happened. So other predictions I mentioned in December 21 already. The um, um, Omicron relief. I I told him got the COVID grab number 15. If you click on TB in the in that's my YouTube video. Um, you can see the history of that, and the other episodes. Anyway, December 21, I said already, based on what you see in South Africa, we should be happy with that. Omicron is coming because it's replacing the more deadly um, Delta. Um, the ones where I was a bit more off was monkeypox. I uh, I put that in number 40, I believe. Let me just take a quick look. Was it number 40? Yeah, the monkeypox script. So I published that in last May. Um, Especially when a monkeypox simulation was done already, I was like, well, that's gonna be a script, and yeah, it's gonna lead to more restrictions. I have to admit I was at least partly wrong because, like, I mean, the World Health Organization says to this day still it's a global emergency, monkeypox, but um, at least it hasn't led yet, and I don't think they can pull it off now to mandatory vaccinations. So um, so yeah, I was afraid that they would use monkeypox more for more restrictive measures. But this is for me the reason that I keep on doing these videos, because like I'm concerned with especially central bank digital currencies, that they're gonna use whatever reason, climate or energy crisis, Ukraine war, you name it, gonna use any reason to introduce central bank digital currencies. I'm concerned that as soon as we have digital currencies, then it's going to be the end of freedom, and it can be under whatever disguise. But like I'm now very sensitive to government narratives, all leading to the same thing: more control, and it needs to be digitalized. And the reason is it's better for the environment, or it's better for your own safety. Um, we can make. I'm not against rules at all, but if if you're uh, if the rules, at least if the rules make sense. I mean, I don't even mind a world government as long as the government is very reliable. But like, if you've seen what happens with the COVID-19 vaccinations, that I'm not against in principle, but like when they said, like, when even the president says, if you're going to get vaccinated you don't get COVID, yeah, that's a lie, and that's always been a lie. There's no new science. That's always been a lie. So that's why I'm skeptical about the um, the government policies. Anyway, try to stay positive. If people are sheep, if people are sheep, if you notice that, by all means, let them be sheep. Let them take their vaccinations. Don't go against it. There's plenty of sheep. Um, focus on the people that are lions, or the people that don't know what animal they are. And you can carefully coin, like, I'm a bit skeptical on the government narrative, and see how they respond, and see if you can have a good conversation. Anyway, respect all the people for their own choices anyway, and stay positive, but do your own research.